Tobramycin drops are used to treat eye infections caused by bacteria. It belongs to a class of drugs called aminoglycoside antibiotics, and works by stopping the growth of bacteria. It is important to note that this medication only treats bacterial eye infections and will not work for other types of eye infections. Using this medication unnecessarily or excessively can decrease its effectiveness. The recommended dosage and timing for using tobramycin drops should be determined by a healthcare professional, and it is important to follow their instructions carefully. When using tobramycin drops, it's important to follow these steps for proper application. First, wash your hands to avoid contamination. Do not wear contact lenses while using this medicine, and be sure to follow the manufacturer's directions for sterilizing contact lenses. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Then, look downward and gently close your eyes for 1 to 2 minutes. Place a finger at the corner of your eye near the nose and apply gentle pressure to prevent the medication from draining out. Do not rinse the dropper, and replace the dropper cap after each use. If you are using another type of eye medication, wait at least 5 to 10 minutes before applying other medications. It's important to use eye drops before eye ointments to allow the eye drops to enter the eye. Use tobramycin drops regularly at the same times each day to get the most benefit from it. Continue using the medication for the full time prescribed, even if symptoms disappear after a few days. And be sure to inform your doctor if your condition lasts or gets worse. If you experience tearing, eye redness, eye discomfort, or eyelid itching/swelling, it's important to notify your doctor or pharmacist. Your doctor has prescribed this medication because the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects. However, prolonged or repeated use may result in a new fungal eye infection. Be sure to use this medication only as prescribed and contact your doctor if you notice any new or worsening symptoms. While very rare, a serious allergic reaction may occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Before using tobramycin drops, make sure to inform your doctor or pharmacist if you have any allergies, especially to aminoglycosides like gentamicin. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss any concerns with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have other eye problems. After applying these drops, your vision may become temporarily blurry or unstable. Do not operate machinery or drive until your vision has cleared. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is also unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. When using tobramycin drops, it's important to be aware of potential interactions with other drugs that could affect its effectiveness or lead to unwanted side effects. Make sure to keep a list of all the medications and herbal products you are using, and share it with your doctor and pharmacist. It's crucial not to make any changes to your medication regimen without consulting your doctor first. This will help ensure the safe and effective use of tobramycin drops. If swallowed, tobramycin drops can be harmful, and an overdose may result in serious symptoms such as passing out or trouble breathing. In such cases, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Do not give this medication to anyone else. This medication has been prescribed specifically for your current condition. Throw away any leftover medication after you have finished your treatment. Do not save it for another infection unless your doctor instructs you to do so. If you forget a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Don't take extra doses to make up for the missed one. When using tobramycin drops, it is important to follow the storage instructions provided on the product package or by your pharmacist. Make sure to keep all medications out of reach of children and pets. Do not dispose of Tobramycin drops by flushing them down the toilet or pouring them into a drain unless specifically instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult with your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.